way. And I'll explain why. For the last almost 50 years, St. Ghana has been using the participatory evaluation work to assess various policies. Throughout those years, one look at has been those related to, or those policies that are supposed to improve the plight of persons with disability. So that's one of the uniqueness about this, that for the last almost 15 years, we've been doing this work. Working with persons with disability has been one thought to highlight and to draw attention to, in the hope that the policies and programs that the government has in different development projects can better reach and improve their lot. But it's so important for those of you who are familiar with the WU, have 5 so in what we call economic policy literacy, we try to build awareness on what the government intends to do for a particular group of people we're talking about. What is the government policy? How does the government want to help persons who have disability? So we educate them about the policies. We educate them about the different instruments that the government has put in place. The next phase is what we call the monitoring and evaluation. If they have been educated and they are aware of the program, we now want them to tell government how is the program impacting on their lives. That's what we call the research phase. So we do the monitoring with them, and they tell us. Out of that monitoring, we publish these reports. We publish a report like this, which is a report to say to government and the public, the policies that you have, in this case for persons with disability, from the point of view of the person with disability, from the work that we've done with them, this is how your policy is impacting on them. These are the areas that the policies could be improved upon. So it's a very important piece of work that we do at that stage. Now, the next stage is what we call the advocacy phase, when we engage government and try to challenge government with that policy, but more importantly, try to get government commitment. These are the good, these are the bad, these are the areas where your policies could be improved. What do you have to say? That is what we call the commitment. Now, out of the advocacy phase, we go to the responsiveness phase. That is where government says, okay, from the finding, you said this, you said that. This is what we are going to do to help correct some of the weaknesses in the implementation. Now, for the past 15 years, we've never gone back to systematically document when government says it will do this, and it has done it, to document the implementation of commitments that government make. With the person with disability, one of the commitments the government made in 2010, they said that they were going to put in place guidelines for the use of the 2% District Assembly Common Fund. That was a commitment that they made in response to saying Ghana work on the use of the District Assembly Common Fund 2% for persons with disability. Government has put in place that measure. We call that commitment in response to our research. Then we went back. Now you put in place the policy. You put in place the guideline.
What is happening? Is it being implemented? So in that sense, it's very important. It's not just that we put out a document and government says we will do this, we don't hold government accountable. No, we do. We do. But it also shows something very important, that government does listen. Because when we challenged government with a report in 2010, it put in place measures in response to that. But that's not sufficient. We should go and find out. The devil is always, they say, the taste of the cake is in eating the pudding. It's in the pudding. So we went to find out. You've put in place the guidelines. Is it working? What new challenges are emerging? And that is what this discussion is about. So from the point of view of policy work in Ghana, and I have done it for many years, this is a very important meeting you are having, where government has responded to demand by beneficiaries of its program. It put in place measures to correct the weaknesses, and now it is being confronted with responses of whether the measure it has put in place is working and whether there are new challenges. And that is the subject of this report. So for those who are interested just in the intellectual aspect, in the whole question of monitoring and holding government accountable from the methodological point of view, this is interesting to look at. And that's why I say it's an important occasion. For those who are interested, whether government can respond to civil society holding it accountable, this report is also important. For those who are interested, whether the work that we do in civil society, whether it adds value, whether it makes a difference in the lives of people, this report is important. And today's occasion is important for those reasons. So on that note, I want to welcome each and every one of you, as I've already said, especially to hear about this report, what government has done, and what the persons that it is supposed to impact on, what they've said, as to whether it is doing what it's supposed to do. So I want to welcome you, and I hope you take it up, and I hope that we can have a very lively debate. And as always we do in SEN, we look forward to the next phase. So on that note, I now hand you over to our facilitator, our chairperson, and you are most welcome.
Thank you very much, Mr. Kamara. I think what you have said is well noted. Our own father of the president of GFD, Ghana Federation of the Disabled, the president of the West Africa Union of Blind, that's AFRO for short, a board member of Africa Union of Blind as well, a family member, and also a very active person on disability issues and developmental issues. Shall we all welcome our own father, Mr. Ofori Yao Deborah. Thank you, Senator. May I ask Mr. Deborah to give us his remarks?
Thank you, Sun Foundation. Findings of the research that was conducted into the operations of the Common Fund. As you may all know, the Common Fund, that is the 2% of the Common Fund for persons with disability, came into effect in the year 2005 after the review of the GPRS 1, that is Ghana Poverty and Reduction Strategy 1. The review showed that the GPRS 1 did not cater for persons with disability, even though it was trying to alleviate the poverty of the poor in the country. And we all recognize that persons with disability fall within the brackets of the poorest of the poor. So the GPRS too made provision for persons with disability, and for that matter, the government directed that the District Assembly Common Fund should have a portion for persons with disability. What it failed to do at that point was to give clear guidelines as to the disbursement and the utilization of that allocation. I quite remember that all that it stated in the sharing formula of the Common Fund was to support the initiatives of persons with disability. This unclear directive lent itself to various interpretations by the district assemblies. Again, it also stated that the allocation should range from 1 to 5%, which means that districts were to decide on which percentage was to be given to persons with disability. For this reason, it was very difficult to actually evaluate what the districts were doing, because you could not know how much a district has allocated, whether 1% or 2% or 5%. Again, districts refused to divulge the amounts that have been allocated to persons with disability to the beneficiaries. So they could not actually pursue to know whether all the amount allocated to them has been allotted. For this reason, it generated a lot of conflicts between the beneficiary communities and the district assemblies. To this end, Ghana Federation of the Disabled was inundated with so many complaints, and in order to solve this problem, GFD secured funding from the then Ghana Research and Advocacy Program, GIRAP, which has now dissolved into Star Ghana. And we were able to conduct investigations or research throughout the country. We actually took districts, one district from each of the 10 regions in Ghana, and we were able to bring stakeholders together. These stakeholders included PWDs themselves, social welfare departments, local government, and partners in disability management. So at the end of the day, we were able to bring all stakeholders together to actually accept or agree upon some guidelines to regulate the disbursement and the utilization of the fund. Working in close collaboration with the council, the guidelines were published and it was signed by the chairman of the council. And this again watered down the impact of the guidelines, because many of the districts did not see the minister's signature. They did not actually give any value to the authenticity of the guidelines. So I quite remember we discussed this issue with the minister, who was then Honorable Fosuampofo, and he actually saw it as a big problem. So he commissioned letters to be written to all districts, directing them to respect the guidelines. Again, we were able to succeed to get the ministers of the then social welfare, employment and social welfare, and local government minister to initial the guidelines. Ladies and gentlemen, with the publication of these guidelines and the implementation of it, we all smiled with optimism that the problems were to be alleviated, but that was not to be. Ladies and gentlemen, we continue to have so many reports again about non-implementation or non-compliance of the guidelines by a lot of districts, even though we can also say that a good number of them also complied and brought relief to persons with disability. We are therefore happy that Send Foundation, a partner organization, has taken this initiative to also go into the problems or the challenges, and they have come out with findings that confirm the problems or the issues that GFD earlier discovered, and therefore developed the guidelines to resolve these problems. So, ladies and gentlemen, we believe that as we are all gathered here, we will also take a second look at the findings and see where we all agree with, and then make common recommendations to government to actually find ways of implementing the guidelines to get the full impact of the disbursement and the utilization of the common fund. Ladies and gentlemen, I must also add that persons with disabilities have also contributed to the difficulties of the implementation of the fund. Some of us actually do not appreciate the value of the fund. The overall objective of the fund is to minimize the poverty and hardship of persons with disability. Some of them receive their funds and they don't put them to the use for which they collected the fund. Again, we also realize that some of them rely on it solely as the only way to actually support themselves. For example, we all agreed that the fund is to support us somehow. For example, if you are a student, you should not see it as a full scholarship. But we also realize every term, students fall on it as a way of paying their user fees and other commitments to their educational institutions. And this also creates a problem between those who are not students and the students. Again, we also realize that some of the representatives on the Fund Management Committee representing GFD collude with assemblies to actually cheat some of their members. All these we receive. But the GFD has done a lot to actually solve the problems that emerge. But because we are constrained by funds, we are not able to respond to all the complaints we receive throughout the country. And for that matter, a lot of people have not benefited, a lot of people have been shortchanged, and they call on us every day. But because we don't have enough to respond to them, we have not been able to monitor all the situations that prevail in the DMMS. And for that matter, it is good that we are all gathered here, and let us think out the solutions and see how best we can put the funds to a better use. Lastly, I must also indicate here the government is not helping. It's also not helping. And the reason is that actually, we all know that the District Assembly Common Fund has not been flowing to the districts. But the government, according to our records, have released the funds up to the third quarter of the year 2013. The assemblies have had their share for the third quarter of 2013. These MPs have had their share, except persons with disability. And why I inquired from the Common Fund Administrator, all that he told me was that the Ministry of Finance have not been able to raise our share of the Common Fund. Surprising. 2% of what goes into the districts, it has not been raised. The issue is that it's 2% of what goes to the districts and municipalities. Why have they received, and where is our 2%? I've called him severally, but he has no answer to my queries. So this is the situation as of now. They are owing us our third quarter, and we join the rest of the country to ask, where is the money? On this note, ladies and gentlemen, I thank all of you with a common solution to the problems that continue to plague the implementation of the Common Fund. Thank you.
Thank you, Mr. Deborah. 1.2% for persons with disability. Maybe we'll have to also start asking as a kind of way. So on that note, we'll call upon the representative of the Ministry of Local Government and Rural Development, Madam Oni, to give us the address from the ministry.
I am particularly happy to be here, since this platform is geared towards seeking stakeholders' commitments to address the identified problems in the report. This would enable a collective and participatory discourse on the issue, which is critical for effective implementation. I therefore wish to take this opportunity to commend the management and staff of SEND Ghana for organizations in governance, and we applaud the contribution of SEND in this direction. We would continue to provide the enabling environment for civil society organizations' engagement with government at all levels. Mr. Chairman, distinguished ladies and gentlemen, I wish to assure you that we, as a government, will continue to implement policies and programs that are geared towards improving the quality of lives of Ghanaians, especially the poor and vulnerable in the society. In doing so, government's commitment to deepen fiscal decentralization is critical. The District Assembly's Common Fund, created under Article 252 of the 1992 Constitution to cater for the development needs of the District Assemblies in Ghana, contributes to this factor. Since this intervention has been the main source of funds for MMDAs to implement and develop their plans in their respective districts. Thus, it goes without saying that the timely disbursement of money from the fund to district assemblies is an issue that is really important to government, since this will definitely deepen decentralization in Ghana and empower local structures to cater for their development needs. In addition, the Act mandates government, and for that matter, district assemblies, to set aside 2% of the district assembly's common fund for persons with disabilities. As part of this initiative, guidelines have been developed by various stakeholders in 2007 for disbursement and management of the 2% of the fund. These have had significant impact on the lives of persons with disability who hitherto could not access the fund. They have used this fund to cater for their health, education needs, as well as vocational skills training. Mr. Chairman, these achievements cannot be maintained without proper monitoring on how the funds are managed and disbursed to people with disabilities by district assemblies, as well as the Disability Fund Management Committees, according to the guidelines. It is in this light that I commend St. Ghana for conducting a study in 15 districts regarding the implementation of the disbursement and management of the fund towards persons with disability in the 2014 report. Mr. Chairman, I am happy to note that in all the districts studied, addressed, and harmonized, in 40% of the districts surveyed, there were no representatives by the National Council for Disabled Persons on the district committees. This, we all know, has an adverse effect of addressing the particular needs of disabled persons, since the absence of these representatives affects the overall monitoring and evaluation of the program. These issues, among others, I have been informed, would be presented by St. Ghana for our discussions as stakeholders. I must say that government is prepared and willing to implement the decisions that would emerge from this meeting to improve the lives of persons with disability and, for that matter, all Ghanaians. Let me also emphasize at this point that government attaches great importance to the Disability Act, and the ministry will remain committed to the implementation of the Act, as well as all measures put in place to empower persons with disability in Ghana. On this note, I wish you a very successful and fruitful stakeholders